Now to matters health, the Ministry of Health has launched a campaign to immunize over 800,000 children against polio in the county of Nairobi as from the 9th to the 13th of May this year. This follows the discovery of polio virus type 2 at a sewer in Eastleigh estate in March this year. The virus, similar to one discovered in Somalia last October, presents a high risk of infection to children and may cause paralysis. According to the World Health Organization country representative, the discovery means immediate immunization plans for all children under 5 years in the Horn of Africa. Refugee children below 15 years entering the country through refugee camps will be screened and orally immunized as well.
This outbreak is considered a regional outbreak because it involves Somalia as well as Kenya, and it may soon involve Ethiopia, we fear. It's considered a regional outbreak and a public health threat of international concern to the entire Horn of Africa region.
And it's in the context of global polio eradication that this issue needs, I think, to be seen. This is not only a national, it's also a regional, but it's an international setback, no question. As you know, there are 3 polio viruses. The world had actually stopped vaccinating against type 2, and here we have circulating vaccine-derived polio type 2 in Somalia and now in Kenya.
Put more money in sanitation, put more money in surveillance at the county levels. I want to appeal to decision makers, put more resources in preventive health care.
It remains still our responsibility as individuals, as technocrats, even as Kenyans, to ensure that we participate in efforts that the government has put in place to ensure that we do not have these diseases. But outbreaks, ladies and gentlemen, especially vaccine-preventable diseases, they just divert our attention. Right now, instead of me concentrating on universal health coverage, I'm now going to start thinking about how do I make sure that I end, as my friend from the Horn of Africa has said, the willingness. Of course, the willingness is there.
Morning, our reporter Caroline B attended the launch of a polio awareness campaign that was spearheaded by the Ministry of Health, UNICEF and the World Health Organization. Caroline now joins us live from our City Center studios with more details. I mean, during this breakfast meeting, as this campaign was being launched, what were some of the fundamental things that came out of what was discussed?
Afternoon to you, Akisa. Looking at the progress that the country has made in eradication of polio, I can say that the country was headed somewhere in recording no cases of polio. But the fact that this one has just been discovered in Eastleigh's Kamukunji area actually presents a big challenge to the country and draws it backwards. That means they will have to reapply to the World Health Organization and other health bodies actually just to tell them that, you know, we are on our way there. But unfortunately, we have reported this case that is going, it not only hit the headlines here in Kenya, but also the international community. It does not only affect Kenya, but also the entire Horn of Africa, that is Ethiopia, Kenya, and Somalia. And given that it's not only in Kenya where this virus has been discovered, but also in Somalia. And that's why they decided to kickstart the campaigns starting from 9th of March to the 13th of March. And since it was discovered in Nairobi, Nairobi is actually a hotspot for this virus. It also includes counties such as Wajir, Mandera, there's Kajiado, there's Machakos. This is where actually a majority of people tend to move in and out of the borders. There is also Lamu, which actually borders Somalia. So these are the counties that are actually at a high risk of the polio virus. And maybe you might ask, how is this virus actually passed? The virus is present in sewerage areas. So what actually happens is that when someone takes water that has been infected by this virus, then they actually get the virus. So part of maybe some of the measures that the Ministry of Health says it's going to undertake as soon as possible is the oral immunization, which is going to begin as soon as possible from this week. Then in June and July, they're going to proceed to the other counties. There's also the screening of refugees who will be getting into the country, children below the ages of 15, to see where exactly could this have happened and who exactly is infected as of that time. But currently, there are no cases of any child having shown any symptoms of this disease. If you look at the symptoms of polio, actually, it's very hard to recognize that, you know, this is polio in a person. So what actually happens is that in mild situations, you will find that people with this infection, they will have a mild headache, there's vomiting, there's diarrhea, but in very low cases. That's why it actually makes it very hard to detect. And so the country is actually on high alert against this because this is some of the diseases that the world needs. The world is actually looking forward to eradicate as soon as possible. Some of the two diseases which have been eradicated so far in the entire world is smallpox and rinderpest. Currently, that is no longer in the world, and Kenya was hoping that as soon as possible they are not going to report any cases of polio. But that has actually come up after the surveillance was done in March, and the report came out that, you know, Kenya, there are traces of polio virus type 2. So there is also going to be a health summit in Geneva very soon. And so all eyes will be on Kenya on how they are going to eradicate this and maybe what measures do they have. And if at all they will need any technical support from different bodies, be it World Health Organization, be it UNICEF or any other body, then the world, some of these organizations who are present in the breakfast meeting have already assured the country that they are willing to give out their support. So concerning the campaign that is going to kick off this week, it has been budgeted that it's going to cost 100 million shillings, and it's targeting 2.4 million children by the end of June. But beginning in Nairobi, they are targeting a total of 800,000 children. Well, Akisa, that is the update I can give you concerning this scare that has sent the Ministry of Health actually running up and down to ensure that, you know, such cases are eradicated as soon as possible.
Right.
Akisa?
Thank you for that update. Caroline B. there joining us live from our city center studios. The conversation on the reemergence of the vaccine-derived poliovirus type 2 continues. Our medical correspondent, Dr. Mascarir, will be joining us later with quick facts on what is this we are dealing with. And we'll be having an extensive conversation with Dr. Super Tunje. She's the Treasurer General at the Kenya Medical Association as well as a pediatrician. I want us to take a quick break. We'll be back with that and more